Sex may be magical, but STIs aren't Voldemort. You can say their name and talk about them and even get tested for them. Otherwise, your rom-com will soon turn into a horror movie, faster than flu powder. So, what does a sexually transmitted infection even look like? And what do you do if you have one? Let's find out. I spy an STI. You need to be on the lookout for STIs if you've had any sort of sexual contact. Yes, that means more than just penetration and can include oral sex and sharing sex toys. So, if you've recently gotten down and dirty, take note because a majority of STIs actually show no symptoms. And remember, nothing can replace personalized medical advice from your doctor. 1. If vaginas were an app, Discharge would be its push notification. Cloudy, dark or smelly discharge means warning. 2. If relieving yourself is giving you no relief, you might have an STI. 3. Love hurts, but sex shouldn't. Unless you're into that. If you feel pain during penetration, that could be a warning sign. 4. Breakouts might make you want to rush to the parlor. But what about skin issues in other places? Rashes, warts, ulcers, and sores on your genitals or even other body parts could indicate an STI. 5. Feeling low? STIs go all, "This is Sparta!" on your immune system. So if you have fever, nausea, or a sore throat, it might not just be the flu. If you have had unprotected sex with someone new and haven't got tested for an STI, do it ASAP or things might get rocky. Testing 1, 2, 3. No need for pre-exam jitters. You don't have to study for an STI test. Just showing up means you get an A+ for investing in your sexual health. Getting tested is simpler than decoding who's who on a group photo on a dating app. Step 1. Speak with a doctor about taking a test. They might ask you some questions to decide which type of test is best for you because you're the main character. Then, you can go to a health clinic or diagnostic lab and request the STI test that has been recommended for you. Step 2. Give a sample, which would mostly mean a blood test or a urine sample. Step 3. Wait for your results. You could even get your blood and urine sample collected from home if going out makes you feel all, "Ew, David." Tests can range in price from anywhere between 1,800 and 50,000 rupees. But before you get discouraged, think of it as an investment where your health is the NFT. But the awkwardness. Yes, talking about STIs and sexual health is awkward. But since STIs are often asymptomatic, you could have an STI and spread it without even realizing it. Like checking for onion breath before going in for a kiss. Make sure you're all clear of STIs too. Multiple partners or just one. Your first time with them or the 69th. Get tested. And don't be afraid to communicate with your partner.